April is Limb Loss Awareness Month, and in this video, I am going to answer the most commonly asked question I get, and that is, do I suffer from phantom limb pain or residual limb pain? As a bit of a refresher, phantom limb pain would be the discomfort that you feel in the missing part of your body. In my case, I'm missing my right foot. Phantom pain for me may feel like my foot is getting crushed, or it's getting burnt, or my ankle is getting twisted. Residual limb pain would be pain within the stump itself, perhaps right at the surgical site along your incision, or the inability to tolerate the sensation of touch, either yourself touching your residual limb, someone else touching the residual limb, the sensation of fabric on your residual limb, or the sensation of you get when you wear your prosthetic leg. Many amputees suffer from both of those. Now, as a bit of a refresher, I am an amputee as a result of complex regional pain syndrome, and my amputation was a rather controversial method of treating my CRPS. It doesn't work for many patients. For me, it worked amazing. I haven't had any reoccurrence of CRPS pain either in my residual limb or in other areas of my body. I can't say that I really suffer from phantom limb pain. I can't say that my stump hurts, other than instances where perhaps I've overdone it. Either I've walked too far or worked a little bit too hard one day, or I'm a bit dehydrated, or haven't looked after myself properly. Then yes, sometimes my stump will act up a bit, but it's easily manageable. Now, I am in a transition in my employment. I'm trying to get out of the construction industry and into something that's a little bit more academic related. And part of that transition involves a bunch of aptitude testing. Tests on English, basic knowledge, history, mathematics, geography, current events. The first day of testing, I was in a classroom, locked away in a little cubicle for 8 hours doing paperwork. And let me tell you, my anxiety started to rise, my stress levels started to rise, and suddenly I was getting both phantom limb pain and residual limb pain. Nothing I could do, touching my limb, trying to calm myself down, nothing could help. As I was going through those tests, I was getting more and more upset. The more upset I got, the more my limb hurt, the more my phantom foot hurt. So, take a break in the testing, got to talk to the instructor a little bit. She looked at some of my test results. We were talking a little bit about my history with the amputation, and she informed me that my test results so far, some of them are actually quite favorable. I definitely wasn't as stupid as I felt during this testing. So, continuing testing in the afternoon. My stress levels were much lower. My anxiety was much lower. My phantom foot, my limb didn't hurt at all. So that is a little bit of an explanation of just how powerful the human mind is over controlling pain, or perhaps manifesting pain that really shouldn't be there. So that's a little bit of an explanation on phantom limb pain and residual limb pain. Alrighty guys, take care.